How can you control your health, not necessarily just with medicine, but by the foods that you are eating? There's a big way to do it. Nutrition tips can make all the difference in terms of your health and preventing diabetes and all kinds of other chronic conditions. And my guest today has just penned an article on One Green Planet all about that, where she gives 10 tips to do just that. Today, we are going to be talking about the top five. And with that, we welcome Dr. Hana Kahleova back to the exam room. So good to see you again, Dr. K.
So great to be here, Chuck.
So, when we're talking about overall, before we pull up your article, which is phenomenal, by the way, before we get into these 10 tips, I've been talking recently on the show about just how insanely sensitive the body can be in terms of the fuel that we put in it. You put good fuel in, healthy food in, amazing things happen. But you put that unhealthy food in, you go to El Cheapo gas station essentially and fuel up on junk food. And guess what? Bad things happen. You've been doing nutrition research now for so many years. Are you still astounded by just how sensitive our bodies can be to this?
I am. It takes usually decades to, for example, develop diabetes. And yet, when you put the right fuel in your body, the changes start really happening over a course of a few days, and in a few weeks you can see significant improvements. And sometimes it's just astonishing how fast these changes happen on the right kind of fuel.
All right. Now we are going to go ahead and pull up this article right now. You see it right there from One Green Planet 10 nutrition tips that help prevent and treat diabetes and other chronic health conditions. We're going to talk about the top five here today, but for the full 10, you can click on that link that is in the show description, or if you're listening to the podcast, click on it in the episode notes. Now, Dr. Kahleova, let's go right on down to the first tip, which shockingly with this group, number one overall, eat a healthy plant-based diet. So in terms of putting good fuel in your body, I suppose this is about as good of a start as it gets.
Exactly. Just consider what happens when you don't put the right fuel in your body. How often does diabetes develop in people? So the stats from the American Diabetes Association show that about 37 million of Americans, that's about 11% of the US population, has diabetes. And another 96 million people, that's about 38% of the population, has prediabetes. So these numbers should just wake you up and be like, you know what? This is something that's really important. That's something that more than half of the population will somehow encounter. Their blood sugar control will somehow come up during the checkups with their doctor. So this is a topic that's super important because it's not only about your blood sugar. It's about the complications that can develop later. It's about your kidneys. Diabetes is the number one cause of kidney failure. It's also about your vision. Again, diabetes is the number one cause for blindness in the US. It's also about your cardiovascular health because diabetes accelerate atherosclerosis, and people with diabetes have a 5 times higher risk of dying of cardiovascular disease than general population. So all of these are important aspects of health, and those are the reasons why you should care what you put in your body. Now, the good news is that when you put the right fuel in your body, you can completely tip the odds. People who follow a vegan diet have their diabetes risk cut in half compared with those who don't. Also, they have a much lower chance of developing diabetes compared to general population. So these studies are interesting, but you may be asking, well, but what if I already have diabetes? Is it now too late for me? And the good news is that it's not. It's never too late. Even if you have diabetes, a few research studies have shown that when you switch over to a low-fat vegan diet, you can improve your blood sugar control, you can lose weight, you can improve your blood lipids, your blood pressure, and other cardiometabolic markers of health. And so you can improve your health in general, and that also includes your diabetes. And what's amazing is that a vegan diet can be twice effective in bringing down your blood sugar compared to a portion controlled diet, one that would be like a standard diabetes diet. So a vegan diet is really effective in the prevention and also in the treatment of diabetes. And if diabetes runs in your family, eating a healthy plant-based diet is the number one recommendation.
Yeah, let me just revisit that because I think that this bears repeating. Did you just say that a plant-based diet, a vegan diet, is twice as effective as the standardly prescribed diet for people with diabetes right now?
That's exactly right.
That is enormous difference. That is so big. I wish a lot of more people knew that. Goodness gracious sakes alive. And you also were talking about it kind of never being too late. So even if you
Mhm.
have diabetes, what about for somebody who's had it for 2 decades or longer? I mean, really just been saddled with it for years.
Yeah, even if you've had diabetes for a long time, it's never too late to make the change. Uh, Even if you have type 1 diabetes, you can give it a try. You will probably need to continue using your insulin, but you may cut down the dose of your insulin. You may be able to cut down other medications that you're using. Even if you're not able to reverse the process completely, you can still see significant improvements in your overall health.
There you go. Significant improvement. So there's only upside to this. Very little down. I mean, no downside that I've heard so far. So that's really important to talk about. Now, number two, we're talking about putting all of this good fuel in our body, but what about the time that we put the good fuel in? So you see there right in the middle of your screen, the second tip: start and finish eating your meals early in the day. Why is meal timing so important?
Exactly. Why is it important? Because meal timing is the cue that helps to synchronize our body clock. We have two body clocks. One is in our brain, which is entrained by the light and darkness cycle. And then we have body clocks in each cell of our body, in each organ. And these are synchronized with the central body clock using nutritional cues, such as cycles of eating and fasting. So when you eat, you tell your body it's day, it's time to ramp up our metabolism. When you stop eating, you give your body a signal to rest. It's that simple. And the better you align your meals with the times of the day, the better for your metabolism. One fascinating study looked at people who were overweight, had fatty liver, had insulin resistance, and had a metabolic syndrome. That means they were overweight, but had also troubles with their blood sugar and also their blood pressure. And so this is just a cluster of symptoms. Now, what's the way? What's the way out? We already talked about a plant-based diet, but this study didn't change what people were eating. But the researchers decided to do a fascinating experiment. In the first group of people, they allowed them to eat for 12 hours a day, from morning till the evening. So if you start eating your breakfast at 7, you finish eating at 7 p.m. If you have breakfast at 8, and then your dinner would be at 8 p.m., and then you wouldn't eat anything afterwards. So it was 12 hours of eating and 12 hours of not eating or fasting. And the second group of people had only a 6-hour eating window. And they were done eating by 3 p.m. Now, was there any difference between these groups? Absolutely. In terms of their metabolism, the one with the 6-hour eating window was much better off. Their insulin sensitivity went up. The beta cell responsiveness, the way how the beta cells in the pancreas respond to meal intake, improved significantly when there was a 6-hour eating window. Also, their appetite was lower, which is fascinating. Many people are like, these people had to be hungry like crazy. I couldn't take it. I would be starving. Guess what? These people had less appetite. Their appetite was suppressed compared to the group eating 12 hours a day. And also, the oxidative stress was less pronounced on eating only 6 hours a day. And what's important to say is that the meal intake was shifted toward the morning. Sometimes people do intermittent fasting, but they just skip breakfast and eat a huge dinner at night. This is not what this particular research study was doing. They did the opposite. People were eating breakfast and lunch and were done eating by 3 p.m.
Very interesting. I wonder, like, so to me, it's kind of a double-edged sword, right? Now, I think we're so accustomed to eating 3 meals per day. It would take a little bit of time to get used to eating just two and being finished eating at 3 o'clock in the afternoon, as the study would suggest. If you do switch to those 2 meals per day, I would imagine those meals are going to be a little bit larger than those who stick with the standard 3 meals per day, correct?
That's right. You eat as much as you like.
Well, all right. Well, that doesn't sound half bad now, does it? I mean, who wouldn't want that advice, for goodness sakes? All right. Number 3 on the list here is having a big breakfast every day will help burn more calories during the day. Now, this is really interesting. So it's not just meal timing, but the effect that this large meal is going to have. Talk to us about this extra calorie burn. Where does this come from?
Yeah, this is really fascinating. Sometimes people think, if I have extra weight, let me just limit the caloric intake and let me just start in the morning. I'm not that hungry in the morning anyway, so it'll be like an easy meal to skip. And yet, the research shows that if you eat a hearty breakfast, you will burn 76% more calories during your physical activity during the day, which is like a huge amount, and you cannot make it, you cannot make up for that, right? So if you skip breakfast and are burning 76% less calories during the day during your daily activities, this is just something you will not be able to make up for.
All right. Next one up is this is an important one here. Eat at least 5 servings of fruits and vegetables for a healthy heart. I would assume, Dr. Kahleova, that the standard person eating the standard American diet probably is falling pretty far short of those 5 servings. How much fruits and vegetables is the typical person eating on the typical day?
And that's exactly right, Chuck. The average consumption of fruit is only 1 serving a day, and the average consumption of vegetables is 1.7 servings a day on a standard American diet. So we have ways to go to reach at least 5 servings a day.
Is that 5 servings of fruits and 5 servings of vegetables, or 5 servings combined?
That's combined, but that's a minimum. And
Gotcha.
in fact, there is a study, a systematic review and meta-analysis conducted by a Canadian research group. And that one pulled together more than 80 studies, that included more than 4 million people, and looked at this topic, like, is eating even more fruits and vegetables than 5 servings a day beneficial? And the answer is yes, absolutely. There was a linear relationship. The more, the better. But 5 servings per day is the minimum you should eat. This study also looked at which fruits and vegetables would be the most beneficial. And the answer is, when we take fruit, do you have any guess, Chuck, which fruits would be most beneficial?
To the heart?
Exactly, to the heart. Yeah.
The ones that have the most fiber. I mean, that would be kind of my start. Or they always go with an apple a day keeps the doctor away. I would assume that includes cardiologists.
Yeah, exactly. Bingo. Like apples and pears, that's one of the most beneficial fruits. Uh, I would respond to the question, which fruits are the most beneficial? The ones you will eat. So apples and pears are one kind of fruit that has been found the most beneficial. Then it's also citrus fruit and 100% fruit juice. I suppose this is because in the population studies, these were the kinds of fruit that were consumed the most. That would be, my expectation and my interpretation of the results. Now let's move on to the vegetables. Which vegetables do you think will be most beneficial for the heart?
Anything, it's got to be leafy greens, right? Like if
Yeah,
kale isn't on there, like we're just living
absolutely.
in bizarro world.
Yeah, let's go with the leafy greens.
Yeah.
Any other vegetables?
Oh, I mean, I was gonna stop there. Is there really a bad one? I mean, so again, I'd be looking at the ones that pack the most fiber punch, the ones that are the most nutrient dense. So, I mean, I'm gonna stick with leafy greens, but probably I'm gonna throw carrots on there, maybe beets. You
Wow,
know,
yeah.
what's the answer? You got the answers, Doc. Don't leave me hanging here.
Good guess. So carrots are in. Another one is cruciferous vegetables.
Broccoli.
And there's also one more kind of vegetables that has been found the most beneficial, and that's garlic, onions, and leeks. This family of allium.
The family of aliens. Right. Um, really quickly here, it just dawned on me when we're talking about the number of servings of fruit and vegetables people are getting every day. Does that include the fruit juice? Because you did mention that in terms of benefits just a second ago.
Absolutely. In this particular study, 100% fruit juice is included among the beneficial ones. There is, why is it 100% fruit juice? Why is it not just sugary water with with some fruit flavors? It's 100% fruit juice because there is a good chance that the antioxidants will be still present in the fruit juice. If you get a fruit juice with pulp, you will also get the benefits of the fiber that's in the fruit. And if you squeeze it fresh, that's the best because the antioxidant content will be the highest.
But if a person were to, instead of squeezing that orange and making orange juice, actually eat the orange itself whole,
That'd be
perhaps
even better.
the biggest benefit comes from that. Okay.
And by
Final.
the way, if you eat the orange, don't throw away the white peels because they contain a lot of flavonoids. Flavonoids are, the phytochemicals that are beneficial for your heart, and those would be out if you do a fruit juice. So even the white peels, not the orange one, but the white peels are still beneficial. So
The,
don't throw them away.
you talk about the stringy things that are on the inside, kind of coating the orange. So you want to keep those, but don't necessarily eat the orange peel itself.
Yeah, but also when you peel the orange, You can be really meticulous, and some people just pull away like everything that is white on the surface. If you're not that meticulous, and if you just leave some of the white stuff on the outside, this is what I'm talking about.
Right on. And I know also if you have a recipe that calls for orange flavor and you need some of that orange zest, you just take that peel, you flip it over the white side, and you just kind of grate that on there. Boom, and there's your orange zest.
And it's
You get
yummy.
those better. Oh yeah, packs. I'll even do that a little bit in my tea sometimes, especially in the fall. It's good stuff right there. All right, last but not least, we have one more to go. Eat meals at regular times, and your body will process calories more efficiently. So if you're going to eat breakfast at 7, eat breakfast at 7 every day. Is that what you're saying here?
Exactly. And this is a fascinating area of research. Sometimes people cannot wrap their head around it. They're like, it doesn't really matter when I eat. I just, when I feel like it and when my schedule allows, I'll eat my meals. And guess what? Both, there were two studies, two crossover studies, one in lean people and one in people who were struggling with extra weight. And both of the studies showed exactly the same. It's much more beneficial when you keep the times of your meals consistent. Exactly as you said, when you eat breakfast at 7, just eat breakfast at 7 every day. And when you do that, what can you expect? First of all, the studies show that the blood lipids improved when the timing of the meals was consistent. And second of all, women who were struggling with the extra weight were eating less calories when they were keeping the times of their meals consistent. They were less hungry and they made better choices throughout the day. And also, they were burning more calories in terms of the thermic effect of food, which is the amount of energy that's released in the form of heat after you eat a meal. So if you eat your meals at regular or consistent times, your body will get rid of the extra energy more efficiently.
Fascinating stuff. So I know that we were talking about that eating twice a day and making sure that you have this nice long fasting window. But even if somebody isn't necessarily adhering to that, even if they are eating the 3 meals per day, plus perhaps a snack in there, 1 or 2, if they're still eating those meals and those snacks every day at the same time, are they getting the same benefit?
Exactly. So these are independent factors. The more you can combine together, the more of a change you can see. But at the same time, if you're only doing, let's say, 3 out of these 5, you will still get the benefits.
Yeah, all right, 3 out of 5 isn't bad in baseball. That's certainly an all-star average.
Yeah.
So here's the score. We only got to the top 5, but as you can see again back there on your screen, Dr. Kahleova penned 10 nutrition tips that help prevent and treat diabetes and other chronic health conditions on the website One Green Planet. And again, you can find a link to this right now in the show description or in the episode notes. Go ahead and click on that and read away, my friends. And Dr. Kahleova, I'd be remiss also if I didn't mention that you'll be speaking at the forthcoming International Conference on Nutrition and Medicine that's coming up August 18th through the 20th. You're going to be talking about not just healthy hospitals, but you're also going to be talking about diets and fatty liver disease. So pretty interesting research that you're going to be presenting.
Yeah, absolutely. I'm hoping to see you there.
Oh, I think that you will. You should stop by the podcast booth. We're going to be recording episodes all 3 days. So if you have a couple of minutes, swing by. We'll do a live show right then and right there.
Awesome. Looking forward to that.
There you go. All right. Dr. Hana Kahleova, thank you so very much for your time.
Thank you, Chuck.
If your health IQ is a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for The Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world a healthier place.